Okay, so let's talk about this, because if we can't do this part, then the rest of it gets really challenging. So the first thing that I'd like you to do is to look at what we have here. So let's go back to this slide. So pull up this slide real quick. So we have all these problems, and I said, what's wrong with this? What's wrong with this? What's wrong with this? All right. Now, all you're doing right now is defining a problem. You're just defining, or actually, you're not even defining a problem. You're defining a process. You haven't even started looking for problems. You kind of already go in knowing that there's problems, and that creates a bias in and of itself, right? You start looking for what's broken. All right. So instead, what I'd like you to do is focus on one of the many processes that are going on. So what are some of the processes that occurred during this event? Not necessarily the problems, but what are the normal hospital processes that occurred that things with them may have contributed to this event? Pain scale. So how we assess pain. Pain assessment. That is a process. Okay. You can choose pain assessment. All right. Some of you have already done that. So you can choose pain assessment. So whenever we look at pain assessment, that goes in this center box. You say, okay, what are the inputs to pain assessment? Okay, inputs to pain assessment might be, one of them is what the patient reports. Patient's reported pain, right? And then who's the supplier of that? The patient. So it's one of those weird scenarios where the patient ends up both in the supplier and the customer. So you should be able to take a process, what's an input to it, who supplies that input? Okay. After we assess the pain, let's go the other direction to outputs. After we assess the pain, okay, what's an output of that? I'll let one of y'all answer that. What's an output of that process? What's that? We throw a prescription at it. We're really good at that, right? So yeah, you pick which you may administer a pain med, depending on what that pain scale is. So you're going to administer a pain med, okay? What should be another output out of that pain assessment? Then you're going to reassess pain. That's an output, okay? Patient's the customer to that, right? Okay. Does that make sense? A little bit more sense? Let's pick one more. Let's identify some other processes, and I'll let y'all flesh some of these out. And you should have one process, not more than one. You should have one process, 3 to 5 inputs, 3 to 5 outputs, and then X number of customers and suppliers, because there's only so many people involved in this process, right? Okay, so let's pick another one. What's another process? Let's go back to that slide. So we talk about pain assessment. What's another process that's occurring here? How about ordering of pain meds? Okay. You're ordering pain meds. Okay, so in this case, what would be an input to how you order pain meds? In this case. What was that? Yeah, the order set, right? So there's order sets that can be selected as an input. Okay? Who supplies those order sets? Depends, right? Could be the physician, could be the physician selects the pain order, right? But you know, usually there's IT teams, there's informatics teams. Sometimes pharmacy has a great deal of control. Sometimes it's your P&T committee, right? Y'all can make that up. Whichever one y'all want to pick to have control. P&T committee is a pretty safe bet. Okay, what's an output of that? No, an output of a medication order. Yeah, patient's going to receive the medication. So you could simply say medication administered, and then the customer to that is the patient, right? All right. Is this kind of starting to make sense? Okay. Let's pick another couple of processes so y'all can whittle this down a little bit, and I'll give you another 5 minutes on it. So what's another process? So we've talked about, recap it, medication's been ordered. So we've talked about ordering a medication, talked about assessing pain. What other processes are occurring here? Yeah, so a policy is a tool. What's the process that goes along with it? So in that case, it's pain assessment, right? So the policy is actually an input to the pain assessment, right? Okay. It's kind of tricky thinking of things this way. I know it is. That's the reason we go through it. So, so what's another process that's occurring here? Yeah. So that process is still ordering the medication, though, right? Yeah. You're talking about a solution or an alternative, right? We want to just define the process. It's hard. You got to really back off because we just want to go in and just let's just solve this right now. I know exactly what needs to happen, right? But we're trying to use an easy case to process through it. Okay, so what else is happening here? What other processes are occurring? Well, the investigation's after the fact. We're doing that, right? Medication was administered, right? Okay, you can pick medication administration or pain med administration. Inputs to that are the patient's pain, the policy for that, the order going into it, blah, 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 blah. Make sense? Okay, so what I encourage you to do, pick one of those three real quick. Take another 5 minutes. Try and fill out. I've given you some examples, but I haven't given you all of it. Flesh out what the inputs are, flesh out what the outputs are, and then what their customers, suppliers, and let's rehuddle in 5, okay? All right. I know we're spending a lot of time on this one, but it'll help later. Okay, let's bring that back in. So we're going to need this one to do the next step. So let's make sure we got this one good. All right, so first off, just give me a show of hand. One person from every group raise your hand so I know how many groups we got, so I can, because I'm going to ask who's doing what and all that kind of thing. So give me one hand raise from every group. One hand raise from every group. So we got 1, 2, 3, 4, 5, 6, 7, 8 groups. Sure, why not? Okay, so we got 8 groups. So how many of you picked? So that same person that just raised their hand, just to prevent it from getting mixed up. So, so that same person that just raised your hand from your group, raise your hand if you picked ordering the medication. Okay, good. All right, and then okay, one more, and then same person from the group, raise your hand if you picked administering the medication. Anybody pick administering the medication? No dice. All right. And then let's see, how many of you picked pain assessment? Okay, we got a couple. All right. Other groups, what did y'all pick? Who picked something different? Give me a hand raise so I know y'all picked something different. Was that everybody? Because I did. There's one group missing that didn't raise their hand. Which one were y'all? Order set. Okay, cool. All right. Okay, so let's talk about the order set one then. So we're talking about ordering medications. So what are or pain medications? We can be more specific. So what are the inputs to ordering pain medications? Here, I'm going to hop out of this. Okay, ordering pain medications. What are the inputs? If this is your group, just shout it out. Give me an input. Yeah, because technically we shouldn't order it unless they have pain, right? Okay, that's a really good one. Okay, let's stop for a sec. Who supplies that? Okay, what's another one? What's another input? Okay. Actually, I'm going to be even more specific. Pre-filled order set. Okay. Okay, what else? Who supplies the pre-filled order set? Yeah, sure. Let's say P&T committee because that encompasses everybody. We'll just keep it simple.